my name is Jasmine Prince. We are members of the Gold Humanism Honor Society from the class of 2021. I am here today to welcome you, the class of 2022, to the Student Clinician Ceremony and to the start of your time on the wards. The Student Clinician Ceremony is a program of the Arnold P. Gold Foundation. It celebrates the transition to the third-year clinical clerkships and emphasizes the importance of developing and maintaining a humanistic approach to patient care, as well as self-care. To begin our program, we have the honor of introducing the Senior Vice President for Health Affairs and Dean for the University of Cincinnati College of Medicine, Dr. Andrew Filak. Dr. Filak was named the Senior Vice President for Health Affairs and Dean for the College of Medicine in 2019. He was previously Senior Associate Dean for Academic Affairs, Vice President for Education for UC Health, and founding chair of the Department of Medical Education. In his capacity as Senior Associate Dean, his responsibilities included oversight of the Offices of Medical Education, Student Affairs and Admissions, Graduate Medical Education, and Continuous Professional Development. Dr. Filak also served as the designated institutional official for GME for UC College of Medicine, UCMC, for 32 years. Dr. Filak has received numerous awards during his career, including the John C. Leonard Award from the Association for Hospital Medical Education in 2016, the University of Cincinnati Award for Excellence in 2012, the Parker J. Palmer Courage to Lead Award from the Accreditation Council for Graduate Medical Education in 2009, and Educator of the Year from the Ohio Academy of Family Physicians in 2003. In 2018, Dr. Filak received the prestigious College of Medicine Daniel Drake Medal. A New Jersey native, Dr. Filak received his MD degree from George Washington University and his training in family medicine at the University of Cincinnati, where he served as chief resident. He holds academic appointments as Professor of Family Medicine and Medical Education. He is board certified in family medicine and continues to practice family medicine and teach medical students and residents. Please join me in welcoming Dr. Andrew Filak.
I'm so happy to be a part of today's celebration. I do wish we were all together for this event. The coronavirus has forced much of our lives into a virtual world, but we will make the best of it today and still enjoy this ceremony, for there is much to celebrate. Please know that while we may be physically apart, spiritually we are all together. To begin, I offer each of you my congratulations. You are officially midway through your medical school career. This is indeed an important milestone in your education. For the last 2 years, your focus has been on the classroom, the laboratory, and in your textbooks. Sir William Osler was the first to bring students out of the lecture hall for bedside clinical training. As he stated, he who studies medicine without books sails an uncharted sea, but he who studies medicine without patients does not go to sea at all. Thanks to the Arnold P. Gold Foundation, we have held this ceremony annually for the past 20 years. As you enter your third year, your primary attention now turns to your patients. You are entering the clinical portion of your education during a very difficult time in our nation's history. The coronavirus continues to spread throughout the world, and especially here in the United States. It has changed the way we practice medicine and how we live almost every aspect of our lives. Added to that, there has been prolonged civil unrest and demonstrations in most American cities, activated by the deaths of George Floyd, Breonna Taylor, and Ahmaud Arbery, among others. It is not yet clear how these will intersect, how coronavirus may impact the hundreds of thousands of people protesting in close proximity to one another, and what it may do to the number of COVID-19 patients in the near future. But this outcry has reawakened the need for us to focus on social injustice and racial inequality, issues which greatly affect the health of people of color, particularly African Americans, the very same people in communities already burdened by a history of prejudice, poverty, and racism, both here in Greater Cincinnati and beyond. It has reminded us to look closely at how we care for all of our patients and as a medical community, work harder toward providing and achieving optimal health for all. You will soon be in hospital units working directly with patients. You are about to become part of the care team, working with residents and attending faculty, along with colleagues from the nursing, pharmacy, and allied health professions. As you begin working with patients, I ask you to keep in mind the following words of Osler. The good physician treats the disease. The great physician treats the patient who has the disease. Keeping the best interests of your patient first and foremost in everything you do will serve you well. Remember that each patient is a person with their own particular set of circumstances, life experiences, and challenges. Their illness may be like that of many others, but each patient will be unique. Remember the human connection in medicine. Create a strong patient-physician relationship with each counter, and you will be well on your way to becoming a great physician. You will also be treating patients from all walks of life, of differing races, religions, cultures, and backgrounds. Remember to honor, recognize, and accept each person, regardless of their background. Treat them as a person first. You will be an important part of the team. While much will be expected of you, there will be significant support for you. While you will feel great pressure to make the right decisions for your patients, there will be support ensuring that the right decisions are made and that your patients receive the finest care. There will be support for you from your instructors as they have been through the same situations and challenges that you will face. There will be support for you from mentors, such as Drs. Kim and Sachs, Pritz and Tang, who will be recognized in the ceremony today. There will be support from residents and the students who were in your shoes last year. There will be support from your fellow third-year students, from your family and your friends. You will not be alone. Do not be afraid to ask for help. I remember how scared I was at the beginning of my first clinical rotations. This was an era when we had very little exposure in the first 2 years of medical school. For you, our curriculum and our faculty and preceptors with whom you have worked during your first 2 years have provided you with the framework to succeed. You will find that you know more than you think you know, although you still quickly will realize that you have more to learn. Still, you are ready for this next phase of your education, and we believe in you. I can assure you that you will have many great days during the next year. You will learn an immeasurable amount from your instructors, and most importantly, from your patients. You will enjoy the thrill of changing lives and saving lives. But you will also experience the anguish of losing patients to disease, the frustration of not having all the answers, and the distress of making mistakes. My first rotation as a third-year medical student was pediatrics, and my first patient was a little girl with a brain tumor. That is something that I will never forget. But I also have the privilege now of taking care of patients who I've been seeing for 40 years, ever since I was a resident. That is a true honor and a privilege. It is up to you as to what you make of your clinical experiences. And as Osler said, to each one of you, the practice of medicine will be very much as you make it. To one, a worry, a perpetual annoyance. To another, a daily joy and a life of as much happiness and usefulness as can well fall to the lot of man. Each one of you has a potential to succeed and to thrive and to experience that daily joy and a life of happiness and usefulness. I leave you with these words of advice. Actively participate, act professionally, show up on time, treat everyone with kindness and respect, and listen to your patients, and they will tell you the diagnosis. I also remind you to maintain physical distancing, wash your hands, and promptly don and doff your PPE, and take good care of your patients. As Sir Francis Peabody eloquently stated, the secret of the care of the patient is in caring for the patient. Congratulations again on all the successes you have achieved in making it to this point of medical school. We expect great things from you, and most importantly, your patients deserve your very best. Thank you.
Hi, my name is Olivia Gobble, and I am a member of the Gold Humanism Honor Society class of 2021. I am happy to be a part of this ceremony that marks the momentous transition to your clinical training. You really have come a long way and have proven yourself to be extremely knowledgeable in the medical sciences. Third year is your opportunity to put those bookmarks into practice. It will undoubtedly be one of the most formative, exciting, interesting, and challenging years of your medical training. I know this not only because of my own personal experiences, but because of the long-standing tradition for medical students to offer support and guidance to one another at this pivotal point. As a representative of GHHS, I'm here to extend that support and guidance to you. Each of you will receive a book entitled Letters to Third-Year Students. The book was originally compiled by the UCCOM GHHS class of 2013 and was recently updated with letters from both the classes of 2020 and 2021. I encourage you to keep a hold of this book and read the letters periodically throughout your third year. It is the hope of GHHS that this book helps you preserve a strong sense of humanism in medicine and to always value the human connection in the doctor-patient relationship.
Hello, my name is Santiago Serna, and as a member of the Gold Humanism Honor Society, I am honored to introduce our keynote speakers, Drs. Young Kim and Megan Sachs. Drs. Kim and Sachs are resident physicians chosen by third-year medical students, class of 2021, to receive the Humanism and Excellence in Teaching Award and induction into the Gold Humanism Honor Society. This award recognizes exceptional commitment to teaching and compassionate treatment of patients and families, students, and colleagues. In their nominating statements, students wrote, quote, Young was an exceptional teacher during rounds, in the OR, and as an advising mentor. He made students feel valued and emphasized the importance of being prepared, but also of being curious and not being afraid to ask questions. Students also wrote, quote, Megan Sachs was an enthusiastic physician and teacher who made the rotation simultaneously fun and educational. She made sure that students were directly involved in patient care and made it so there was never a boring moment. I had the pleasure of working with both Drs. Kim and Sachs, and I could not agree more with these statements made by the nominating students. Throughout my rotation, they demonstrated respect to fellow healthcare workers, commitment to teaching, and exemplary patient-centered care. I feel lucky to have them as my residents during my clerkship year.
Please welcome Drs. Kim and Sachs.
Hello everybody, my name is Young. I just wanted to welcome each of you guys to your clinical years of medical school. We are all looking forward to having you guys on our various services, both inpatient and outpatient, from the large academic medical centers to the smaller outpatient clinics out there. Megan and I were nominated by the current third-year medical student class representing humanism and excellence in teaching, and we're invited to give this speech. But what is humanism exactly? It's something I've thought about for a while now, what the idea of humanism really means, even though it seems like such an ambiguous and fluid concept still. I think that's because humanism represents something different to everybody. For me, as a surgical resident in my 7th year of training, humanism is it's like realizing that each of us are in different stages of training, even though we all share the common goal of providing the best care we can for each of our patients. Because that's why we're all here today, right? To provide the best care we can for each of our patients with the same amount of empathy as if they were one of our own family members. Every patient is somebody's father, or somebody's daughter, or somebody's best friend. It could even be the person sitting next to you right now. Through your preclinical and clinical years of medical school, it's amazing how you can tell just how much you've learned and grown throughout each stage of training. From first year anatomy and biochemistry, to learn to care for actual real-life patients as third and fourth year medical students. And as you go through your training process, your perspective changes so much too. For the next 2 years, you guys will be spending so much of your time reading, learning, soaking up knowledge from residents and attendings, and trying to figure out just what exactly to specialize in. It's natural for everything to seem so overwhelming for about a month at a time, and then after you start to get the hang of things, you move on to a different rotation, and it all starts back over and again from square one. And this cycle repeats over and over and over until the day you graduate. And then all of a sudden, one day, you guys are real doctors, taking care of real patients, putting in orders, prescribing medications without anybody looking over your shoulders, and cutting on patients. Nurses are paging you constantly with questions that you may or may not know the answers to. You know, the rotation schedule doesn't stop after graduating from medical school, and the exams just keep on coming, and you still don't have enough time to study for all of them. But if you can imagine, 2 years from now, you guys will all be resident physicians with a new shiny MD next to your name. And in 2 years' time, it'll be up to you guys whether you choose to teach or ignore the medical students that rotate through your services. As third-year medical students, you guys will come to understand so well how much the residents and attendings that you rotate with determine how you view the entire specialty as a whole. Whether it's internal medicine or diagnostic radiology or some surgical subspecialty, the residents and faculty you work with become inseparable from the field of practice. For me personally, it's been about 10 years since I stepped foot on the wards as a third-year medical student, but I still remember how impressionable I was back then. And as each of you guys become residents and attendings in the future, I hope you guys remember it too, because it's so hard not to compare your middle to somebody else's beginning. You know, we all share the same goal of patient care despite being in different stages of training, and that's what humanism means to me. And I hope that each of you guys have the opportunity to embrace and practice your own ideals of humanism in your careers to come. We all look forward to having you guys on the wards.
Hello, and congratulations on completing your preclinical years of medical school. We're looking forward to having you join our patient care teams in the hospitals and clinics. My name is Megan Sachs, and I'm one of the OBGYN residents at UC. I'm honored to have the chance to address you today at such an exciting point in your training. Although I'm sure you've been anticipating the 24-hour calls, never-ending morning rounds, and challenging patient scenarios, starting your clinical rotations in the middle of a pandemic is unimaginable. Entering the medical field at a time like this is intimidating and takes more commitment and determination than ever before. While other classes have had the stress of residency interviews, rank lists, you may be comforting and caring for patients isolated from family and friends and be faced with tough decisions regarding lapses and delays in training or potentially being conscripted to outside services or hospitals. However, we are all fortunate to have inspiring role models and teachers during this difficult time, both as leaders of national health coalitions and at this very institution. I'm certain that on your rotations, you will train alongside attendings and residents, taking that extra time to sit with a patient or patient's family member, or go above and beyond to make someone else's day a little easier. Do your best to remain engaged and retain what you see, because every day of your rotations will influence the future physician that you will become. I want to address two important things to keep in mind as you prepare to enter into direct patient care: teamwork and continuing your education. First, movies and TV shows often depict doctors as pompous and short-tempered, especially in relation to interdisciplinary staff. That perception is exaggerated, but nonetheless, doctors in training could continue to be more humble and collaborative. Nurses, patient care technicians, and family members should all be viewed as parts of the patient care team who are present to help promote healing and good health care for the patient. We need to thank them and encourage them, not discourage collaboration. As you advance in your training, you'll have increasing responsibility, and it's important to remember that all members of the team deserve respect and that you should encourage outreach in an environment where everyone on the team is appreciated. I'd like to echo what one of my chief residents said to me as an intern when I apologized profusely for waking her in the middle of the night to discuss a patient. She said, "Don't ever be sorry for being concerned about a patient. That's your job." Make this the same learning environment that you encourage, open to express care and concern for patients. And remember that the best leaders are often good listeners and humble enough to learn from the rest of the team. Learning, and especially self-directed learning on your rotations, is the other thing I wanted to address. It's challenging to move from the PowerPoints, textbooks, and flashcards to studying around your patients and on the fly, but you will learn something new every day if you're motivated and keep an open mind. Many of you will come onto our OB-GYN rotation knowing that you will not likely pursue a career in women's health, and that's fine. But we will expect that you leave our service understanding the stages of labor and ready to inquire about your patient's reproductive life goals. Make us proud, and before you start her on a medication that would be contraindicated in pregnancy, be sure to ask her what her birth control method is and whether she needs trusted resources to review options or a referral. It's important to recognize that even if you intend to be a nephrologist or ENT, no service of the hospital can succeed in isolation, just as one part of the patient is not distinct from the whole body. This is becoming even more apparent at this time in our nation's history when healthcare access is in flux for so many patients, because you must remember that your interaction with a patient may be the only interaction with the healthcare system that they may have had or will have for years. We owe it to our patients to be the best physician learners that we can be, keeping up with the newest evidence-based practice to provide exceptional care. We look forward to working with you, and welcome to the team.
The UCOM Office of Student Affairs created the Excellence in Mentoring Award in recognition of the value of quality mentoring on the career development of our medical students, including their transition to residency. UCOM students submit nominations, and a committee from the Office of Student Affairs and the Office of Diversity, Equity, and Inclusion select the final winners. This year, the Excellence in Mentoring Award go to Dr. Timothy Pritz and Dr. Alice Tang. Dr. Timothy Pritz, a professor and chief of the section of general surgery in the Department of Surgery, is a general and trauma surgeon. He has mentored more than 30 medical students, surgical residents, and postdoctoral fellows, including 3 surgeon scientists within the department. His research focuses on the improving care for injured and critically ill patients through optimizing resuscitation strategies and mitigating potential harm from the red blood cell storage lesion. Dr. Alice Tang, an assistant professor in the Department of Otolaryngology, Head and Neck Surgery, is a head and neck oncologic and microvascular reconstructive surgeon. She specializes in surgical intervention for endocrine diseases and mucosal cancers afflicting the head and neck. Dr. Tang's research interests focus on thyroid disorders, head and neck cancer, and women in surgery. Through her many research endeavors, she has had the opportunity to work with many talented UC medical students, helping to foster their interest in the field of otolaryngology. For the annual recognition of the Optime Magistrum or Best Teacher Awards for Year 2, students vote for one winner at the conclusion of each course. This award is presented to a faculty member in a course who exemplifies the following: is thought-provoking and intellectually demanding, relates the course material to other fields, contemporary issues, or student experiences, is enthusiastic about teaching, is conscientious, organized, and well prepared for class, fosters active or self-directed learning, is available to the students, provides clear expectations, relevant assignments, and ample feedback, presents material clearly, engages students, and stimulates participation, is open-minded, fair, respectful of differences among students, and inspires students to excel. Dr. Laura Wexler, Blood Cardiovascular System. Dr. Keith Luckett, GI Endocrine Reproductive Systems. Dr. Robbie Paulson, Multisystems. Dr. Catherine Wickenheiser-Brokamp, Renal Pulmonary Systems. Dr. Lisa Kelly, Physician in Society 201. Dr. Sarah Pickle, Physician in Society 202. Next, we'd like to present the prestigious Gold and Silver Apple Awards to the faculty winners in recognition of excellence in teaching during the past academic year. The criteria for these awards include excellence in education, including administrative efforts, teaching technology, evaluation methods, innovation in education, exemplary skills in small group bedside, clinical, or laboratory learning experiences, extraordinary sustained dedication and effort on behalf of student education, demonstration of a high level of teaching effectiveness, and respect and support for the development of students as individuals. Our Gold Apple winner is Dr. Laura Wexler. Our Silver Apple winner is Dr. DJ Lowry. Our next Silver Apple winner is Dr. Aaron Marshall.
Oh, I didn't see you there. But since you are here, I just want to take this moment to remind you all that you made it through the first 2 years and you can make it through the next 2. Remember how brilliant you are, how much you've learned, and how much you've grown and matured. And also one more thing, I'm going to remind you all of the oath that we wrote, that we decided that as a class we were going to abide by. And so, read along with me if you can. Class Oath of Professionalism. We, the University of Cincinnati College of Medicine Class of 2022, vow to uphold the principles of this university in the medical profession. We will serve our patients and communities with integrity, humility, and compassion. In the presence of loved ones, peers, faculty, we hereby declare this oath. We pledge to develop as lifelong learners who embrace both tradition and innovation. We will collaborate respectfully with all healthcare professionals, valuing the perspectives of our colleagues. We will acknowledge our limitations and seek guidance to ensure the highest standard of care. We will always value our patients over our pride. We pledge to provide equitable, quality care to all patients. We will uphold the confidentiality and sanctity of the patient-physician relationship. We will respect human dignity and recognize our patients as equal partners in care. We will empower our patients to make well-informed, autonomous decisions that align with their values. We pledge to serve our changing and diverse society with humility and cultural sensitivity. We will promote accessible healthcare and wellness education for all. We will advocate for the needs of our communities against social injustice. It is our honor and privilege to don the white coat and exemplify the values of our profession as we embrace the challenges before us. May the strides we take throughout our careers enable us to care for our patients with integrity, humility, and compassion. And may we find strength and unity as we care for one another. And I really love how this reminds us that not only will we be caring for our patients, but we'll be caring for each other. So as we go on through these next 2 years, remember, some days are going to be good, some days are going to be bad, but always remember why we decided to do this. It was for the patients, it was to help them out. And so as we take care of our patients, let's take care of each other. And let's always remind each other of the fact that we've made it through 2 years, we can make it through 2 more, and we can make it on out through our long careers. And so y'all, hey, let's keep on going and keep on being great.